Welcome to eCareDiary.com's Caregiver Tips and Clips. I'm your host Meghna Giritar. Each week we will focus on a caregiving issue in the form of a short educational video. The subject of today's video is hepatitis prevention and protection. Viral hepatitis is inflammation of the liver caused by a virus. Hepatitis viruses are the most common cause of hepatitis, but other infections, toxic substances, and autoimmune diseases can also cause the disease. There are 5 main hepatitis viruses referred to as types A, B, C, D, and E. In particular, types B and C lead to chronic diseases and are the most common causes of liver cirrhosis and cancer. Worldwide, 400 million people are living with hepatitis B or C. 1.45 million deaths are caused from viral hepatitis each year. 81% of world's infants are vaccinated and protected from hepatitis B infection. 2 million is the number of hepatitis B and C infections occurring yearly through unsafe injections. Here we get an overview of the incidence of hepatitis A, B, and C starting from 1982. Close to 30,000 people were infected with hepatitis A virus in 1980, which then spiked to around 35,000 by 1988. The numbers fell to less than 5,000 by 2012. Hepatitis B virus affected close to 30,000 in 1984, but again fell to less than 5,000 by 2012. Finally, hepatitis C cases touched 6,000 in 1992 and fell only to about 2,000 in 2012. Hepatitis A and E is spread mainly by eating food or drinking water that has been contaminated by the feces of an infected person. It also spreads by eating raw shellfish that comes from water contaminated by sewage. There is a vaccination for hepatitis A. Treatment can bring short-term immunity. Currently, there is a vaccine to prevent hepatitis E2, but it is not widely available. The risk of exposure can be reduced by practicing good hygiene and sanitation and avoiding water that has come from a potentially unsafe source. There is no treatment for hepatitis E. As hepatitis A only causes acute hepatitis, the body is often able to clear the infection within a few weeks. However, it can sometimes cause further complications. Hepatitis B is transmitted through contact with the blood or other body fluids, such as saliva, semen, and vaginal fluid of an infected person. It can be passed on from mother to child during childbirth. Hepatitis C and D is mainly spread through blood-to-blood contact. There is a vaccination that can prevent infection. To reduce the chances of exposure, it is best to use condoms and avoid sharing needles or items such as toothbrushes, razors, or scissors with an infected person. One should also avoid getting tattoos or body piercings from unlicensed facilities. There is no vaccination for hepatitis C. Hepatitis D is only found in people who are already infected with the hepatitis B virus. People who are not already infected with hepatitis B should get the vaccination. Drugs such as alpha interferon and peg interferon and a variety of antiviral drugs are available which slow the replication of hepatitis B virus and results in clearance. Treatment for chronic hepatitis C aims to eradicate the virus and involves a combination of pegylated interferon and ribavirin. There is also an increasing use of potent direct-acting antiviral drugs. However, people react differently to different combinations of drugs. When it comes to blood and injection safety, 33% of cases, hepatitis B infections are caused due to unsafe injections. Globally, up to 40% of injections are still being given with reused injecting equipment. 8 billion injections a year are given unnecessarily. And finally, 42% of unsafe injections account for almost 2 million new hepatitis C infections. Globally, 67% of people who inject drugs are infected with hepatitis C. 10 million people who inject drugs worldwide have hepatitis B or C. 1.2 million injecting drug users have hepatitis B. It's time to take action Get vaccinated, get tested, and get better. 240 million people chronically infected with hepatitis B, and around 780,000 people die each year from hepatitis B. Vaccinating children, especially for hepatitis B, is incredibly important. July 28th was World Hepatitis Day. The World Health Organization and World Hepatitis Alliance have announced the campaign theme for World Hepatitis Day 2015, which was all about prevention of viral hepatitis. With better awareness and understanding of how we can prevent hepatitis, we can eliminate the disease and save 4,000 lives a day. The campaign aimed not only to raise awareness among the public and infected patients, but to promote improved access to hepatitis services. Thank you for joining us today. To access more caregiver tips and clips, visit us at www.ecarediary.com. Until next time.